Let's get 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at some answers. And this is rosacea. This is something that is a little bit more common in pregnancy, or pregnancy can flare it up, particularly if you're known to have it already. But you will occasionally see someone that this is the first time they've ever had it, and sure enough, pregnancy is one of the risk factors for it. Of course, the key differentials here is going to be something like acne vulgaris, which is something that can also be flared up by pregnancy. I think the distribution can be quite similar. There tends to be more of that comedonal kind of appearance to it, and normally you do still get some response to using over-counters. Of course, the other differential here would be a periorificial dermatitis or plain old eczema. Again, you'd kind of look to the history for those kinds of things. Normally you'd expect to find history of similar things there. And so in this setting, with this distribution, with this rash, it's rosacea. Not very exciting. How about we have a look at the next question then? Let's get 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at some of the answers here. So, for those who do have a bit of a derm interest, this question should be right up your alley. There is so much we can do that's not just through tablets or gels or creams at people, although part of this, I guess, would be beneficial for it, but also those non-pharmacological management strategies, and of course encourage Sarah to record a symptom diary to aid the identification of triggers, because it's probably not just the pregnancy that's causing it. Yes, that's going to nudge it along, but there's a lot of other things that are going to be triggers for rosacea. So some of those common triggers are, and the things you would just tell her, look, just avoid these off the bat. Spicy foods, hot cold temperatures, so people that like really hot baths or really hot showers, just try and make it a little bit cooler. Exercise, which really sucks, especially when you're trying to stay fit and active, control your weight during pregnancy. He says like he's ever been pregnant. Sun exposure, so UV radiation can be a trigger for a lot of people. Certain cosmetic products, so you'd be asking if anything's changed, if there's anything new, or if she wants to rotate and try older products or different products than she's using currently. And there's some medications, particularly those that cause vasodilatation, that are known to trigger or flare it, or certainly make it more prominent. Alcohol, thankfully she should be avoiding this during pregnancy, but good to double check. And some fruits and vegetables, which can vary person to person, dairy and marinated meat products. Now, they're going to give you the most marks there, but of course other things are those simple things that we often take for granted. So moisturize frequently, try and condition the skin and get it as healthy and in good condition as possible. Use mild synthetic detergent-based cleansers rather than traditional soaps. Use physical sunscreens, so zinc oxide or titanium oxide. I don't think you'd have to specify, to that level, but using physical sunscreens with an SPF rating of at least 30, and avoid the use of topical steroids as they often aggravate rosacea. And unfortunately, the often knee-jerk reaction to a rash is to throw some steroids at it, and it will likely flare if it is true rosacea. Another little sneaky trick that I learned from DermNet that I never knew before, but I guess I've never needed to. Cosmetics with a green tint will minimise the appearance of the redness of rosacea. And so for patients that have issues they really can't get control, apparently you turn them a little bit into the Hulk and everything looks a bit better. You live, you learn. That's a new one for me. All right, we have another question on this case. I'm going to cop hell for that one. Another question on this case. Let's get 2 minutes on the clock. Your time starts now. All right, time is up. Let's have a look at some answers here. So the correct answers here are estriol, alpha-fetoprotein, AFP, inhibin A, and of course, beta-human chorionic gonadotropin, beta-HCG. This is taken directly from RACGP's guidelines for prenatal testing, which you can find in their genomics and general practice section. And this question I've intentionally put in here, so typo on my behalf, I've put in here 3.2. This is indeed question 3.3, sorry. But I've intentionally put this one in here because I want to highlight as well, there's probably going to be questions that you don't know. I did not know this. I had to look it up myself and put in the question together. You may know it. Fantastic if you do. That's actually really impressive. But there's going to be things that are in there almost to trip you up. And sometimes I think they use these to work out who's the super good people that are going to get extra good marks and how to differentiate them from each other. I know from questions I've done in exams previously, I've thought there is no way in hell I would ever have known this. And that's okay. Give it your best. Often these kinds of questions will be multiple choice. Occasionally they are the short answer, in which case just put down what you think is common sense, what you think is appropriate. Don't beat yourself up over it. Really, really important if you come across a question like this where you're just like, I've got no idea. Just give it a go and say, cool, maybe not. Maybe I didn't do fantastic on that question. Let's see how that next question goes. Let's get back to ones that I feel more confident on. So maybe a bit of a mean question, bit of a harsh question, but just to remind you that they do this from time to time. You're not going to know every single answer to every single question, and that's okay. Just give it your best shot. That's all we can ask for on this exam.